Yeah, so we are still working in our objectives. We reframe them. So just to be clear, we are saying that still we're going to estimate the effectiveness of standard treatment for cutaneous leishmaniasis, but within the national program in 3 municipalities. And we are using mHealth as a tool for collecting data. And our 3 specific objectives we frame as an indicators are, first, compliance to treatment and frequency of adverse events. Second, factors, we want to know to determine factors that influence, it means that hinder or that facilitate successful completion of treatment. And third, we want to determine the treatment outcomes in real life conditions. So, So our study is a non-interventional study, is an observational, analytical cohort study, and we will use mostly quantitative methods, but for one specific aim for determining the factors that influence, we are going to use mixed methods. So we, okay, I will move from one slide to the other one. So for our first objective, which is to determine the compliance, so we state the outcomes in the other way, and actually I wanted to make with you the exercise of how can we frame as an implementation outcomes, since we are not, we are exploring, we are determining, in this case, the compliance to treatment. So I will say, so we said that outcomes, we have treatment characteristics, compliance to treatment, and frequency, type, and intensity of adverse events. So probably it could be framed as coverage, I'm not sure. Fidelity?
Fidelity, right, Ari? If it's compliance. Yeah, treatment.
Okay. But
those outcomes is a big terms, but you can have different indicators to show that. And here you show the indicators.
yes.
Yes, that's fine.
Okay, great. So for this, we're going to use quantitative methods. The sampling strategy is this first row. So we are going to do it in all patients identified at risk in townships. Our data collection tools are patient diary, reports form, and paper forms, and apps. We're going to use both. And we're going to do statistical analysis for this objective and presentation in tables and figures. For the second objective, we want to determine factors that influence successful completing. So those are our outcomes. We will have factors identified by patients, by implementers, and also regarding accessibility, we will have availability of healthcare providers, cost, and acceptability. And for this, we will use qualitative and quantitative methods. Sampling strategy, again, all patients that have success, in this case, are patients that are completed the treatment. We will use clinical records, CRF, and interview guide as data collection tools. For data analysis, we will do both statistical analysis and qualitative thematic analysis. And the presentation will be tables, reports, maps. We are thinking that maybe maps could be a good idea to communicate. And for the third objective, which is outcomes to treatment of current treatment, our study outcome will be cure or fail of treatment. It's a quantitative. We will use quantitative methods. Again, in all patients identified at risk, using the same data collection, clinical records, apps, CRF. And for data analysis, we will use statistical analysis and tables and figures as presentation. Oops. Oh, yeah. And then our dissemination strategy, so we want to first create awareness in two different audiences for local health authorities, because remember we are going to work with them in the towns selected, but also with communities, and we were thinking that we need to do this since the beginning, of course. For that, the best channel that we can use is face-to-face communication with them, meetings, and also participation in some program meetings. I mean, not meetings that we organize, but also they have some special meetings, so we want to be part of that. Another objective is update or advance of the project, so with the steering committee, the funding agency, and the ethics committee. And for that, we will use written and face-to-face communications, and the tools will be progress reports and meetings. And we expect to improve decision making. Then we also want to, of course, contribute to reduce knowledge gap to scientific community. So we will do peer reviews and participation in conference. And ideally, we want to have change in policy. So for doing that, we need to target the national program of cutaneous leishmaniasis, and we will do that with written communications and with meeting, and probably policy briefs will be a good way to approach them, and also meetings, which is the most effective way. I think that's it. Mari, something?
Thank you. Comments?
It is a great progress
Yes.
compared to yesterday,
Yeah.
because I were in the team and observing, and then I